Hello everyone, my name is Shay Nair Sharma. I am an incoming senior at Stanford studying human biology and space medicine and a NASA intern supporting the Health and Air Quality program. What if I told you that technologies in space are currently saving hundreds of thousands of lives on Earth every year? During my internship at NASA, I've had the privilege to work with leading researchers around the country employing Earth-observing satellite data for health applications. From land to water to air, health risks permeate our planet. Changing land use and climate patterns contribute to shifting ecosystems, altering interactions between humans, plants, and animals, and creating new environmental and air quality health risks, including wildfires and harmful algal blooms. Addressing these global challenges demands a proactive approach in monitoring and predicting public health threats. Technologies such as smartphone apps, digital platforms, big data, and artificial intelligence can be applied to address urgent health challenges and protect the global community. Incorporating innovative data and technological sources like NASA satellite data will provide a multidimensional and holistic evaluation of emerging environmental and air quality health risks. NASA's Health and Air Quality Applications program uses these novel space-based technologies every day to identify environmental health risk factors and develop comprehensive strategies to reduce the harmful impact. I will illustrate through two example projects how NASA Earth observation data is offering societal benefit and strengthening ecosystem risk analytics, policy decision-making, and public health surveillance through the One Health paradigm. Our first project addresses a growing public health threat in the western United States: wildfires. More harmful than the flames themselves, wildfire smoke plumes and their particulate matter are associated with a host of downstream health consequences. Gaining insight into the particulate matter risk would prove beneficial for state departments to help inform residents when it is safe to go outside. Dr. Jeffrey Pierce of Colorado State University investigated the link between NASA's aerosol optical death particulate matter exposure and health surveillance data from fire seasons in Washington, Colorado, and Oregon. He partnered with their state departments of health to examine hospital admissions data. The findings were incorporated into a smoke health impact assessment forecaster tool, as seen in the figure, to predict particulate matter exposure and health risks in real time. The team now aids state departments of health across the country with their smoke decision-making. Our second project improved forecasts of the respiratory illness hazard red tide. Red tide blooms contaminate the Gulf of Mexico, spreading a neurotoxic toxin into the shellfish that we consume and becoming a respiratory irritant when aerosolized. Since bloom severity can vary from hour to hour, effective forecasts should update coastal residents when and where these blooms would pose the highest health risks on an hourly basis. However, in 2013, forecasts were only updated twice a week. To detect harmful algal blooms, a NOAA team, led by Dr. Richard Stumpf, analyzed satellite data from the Visible Infrared Imaging Radiometer Suite and the Moderate Resolution Imaging Spectroradiometer. They developed the HAQAST, a low-cost, portable, mobile phone-mounted microscope system that utilizes artificial intelligence to quickly analyze coastal water samples for near real-time cell counts of red tide. With the help of citizen scientists, volunteers trained with the HAQAST, and partnering with the Florida Fish and Wildlife Conservation Commission and the Gulf of Mexico Coastal Ocean Observing System, the team integrated satellite and HAQAST smartphone app data to monitor harmful algal blooms in the Gulf of Mexico. After Stumpf's NASA project, forecasts are now updated every 3 hours. With higher resolution forecasts of affected Florida beaches along the Gulf Coast, as seen in the figure, beach communities better understand their risk and can take appropriate precautions. The team has already expanded forecast coverage to the Gulf of Maine and Lake Erie, and aims to cover the entire country's coast. As our planet continues to change, so will the environmental health and air quality threats. However, With multidisciplinary teams that integrate health data with remote sensing, citizen scientists willing to support data collection on the front lines, and continued satellite missions, we can proactively address the growing One Health challenges affecting our planet. Thank you.